Hello, my name is Kathleen Lisson, and today I will be guiding you through the self-massage rubric, and this is appropriate for clients after their explant surgery, after they've had their breast implants removed. So I am going to go through the different parts of the rubric and explain them. I'm going to share some of the self-massage devices and tools that you might use, and I'm going to share with you in the description box where you can get your free copy of this rubric so you can follow along at home, and hopefully this video is going to give you the start that you need to do self-massage. So the most important thing I need to tell you is that self-massage should be in between your professional massage sessions. And it should be when your surgeon approves and says, yes, you can do more self-massage. And this is going to be over and above just manual lymphatic drainage massage. So start it anywhere. Some surgeons say at 3 weeks you can do a more intense massage. Some surgeons want you to wait 6 weeks or longer. It has to be your individual surgeon because they know what they did in the surgery to your individual body. I don't know what happened in your surgery. So why do you want to get this massage? To reduce the appearance and feeling of some of the scar tissue. The scar tissue might be causing a little bit of tightness. You might feel some lumps in the tissue after your breast implant was removed. And your surgeon might say, hey, if that concerns you, go ahead and do self-massage. When should you do this? I would highly recommend finding a peaceful time of the day. So this can't be like 10 minutes crammed in between, you have to walk the dog and you have to pick the kids up. This has to be a nourishing time for you, a time when you can center yourself, a time when you can think those positive affirmations, think those good thoughts, and take some time for self-care as you are healing and recovering from this surgery. So how long? I recommend starting with 10 minutes, 8 to 10 minutes. If you see that you're doing well with the 10-minute session, you can definitely slowly make that longer and spend more time on each breast. But 5 minutes a breast for the whole, all the parts that you want to include in the massage is a good place to start. What don't I want to see? I do not want to see any bruising. I don't want to see any extreme tenderness the day after. So it can be a good tender. It can feel like, oh, I had a good workout. Oh, felt like I did some push-ups yesterday, even though you didn't, but you did this breast massage. So I'm okay with a little bit of feeling. What I don't want is extreme tenderness, and extreme tenderness is your body telling you to back off. So luckily in the rubric, we have some parts of the session that are starting, they're gentler, and then we have the more intense parts of the session, and then we end with some more gentler parts. So if you feel intense tenderness the next day, if you feel unwell, you can go ahead and take those more intense parts out and really customize the massage to where your body is today in the healing process. Because what we don't want to have is just, no pain, no gain, really knuckles tight massage that will keep your breasts inflamed and in that inflammatory process again and again and again. We want this to be a nourishing process and help in your healing. And as I said before, this self-massage is going to be for in between your professional massages. And that is because your professional massages are where your massage therapist can get their hands on you and tell you what they think is happening in your healing, what they feel, and they can see if you bring some of these tools in that I'm going to share with you and say, hey, show me how I might use this. Show me whether you think based on massaging me, you think I need to use this anymore, or do I need to use more of it or less of it? And really let the massage therapist be your partner in guiding you through this recovery. And again, you can track your progress with this rubric, one page for each day, and so you can make unlimited copies of this and then just have this to look back on. And this is really great because maybe the next day you're like, oh my gosh, I feel sick. oh my gosh, I feel really sore. And then you can look at the rubric from yesterday and say, What did I do? How long did I do it for? Is maybe some of what we did in this massage too much for me at this time? So we can back off and change your approach in future self-massages. So this is why I really like this rubric, and I'm offering it to you free PDF that you can make copies, because I want it to be like self-grading device. So you can kind of grade yourself on how well the massages are helping you recover, and if your massages are getting an A or if they're getting an F. Okay, so let's start with parts of the rubric, and I'll go over and kind of share why I included each of these. So I start with a resting heart rate, and I'd love for you to do a resting heart rate as soon as you wake up. So you wake up in the morning, you haven't rolled over yet and drank, your water. I want you to take your pulse either at the neck or at the wrist, and take your resting heart rate and record every day how many beats per minute is your resting heart rate when you wake up. And then before the massage session, how many beats per minute are you with your resting heart rate when you come into the massage session itself. And the resting heart rate may be a good way for you to track whether you might be getting sick or not, whether you are overtraining. Athletes definitely use the resting heart rate every morning to see whether they're overtraining, whether they're able to take more exercise. Exercise is another thing I want you to keep track of. What kind of exercise are you doing? Have you exercised in the previous 24 hours? And kind of leave those notes for yourself. Was it intense exercise? Was it, were you really getting at it? Or was it like a more nourishing, gentle exercise like yoga or stretching? And that can be a factor in if you did a bunch of exercise and then you did a really intense massage session, maybe the next day you're going to feel some soreness. And this is how you can use the rubric to kind of look back and see what may have been contributing to any symptoms that you may feel the day after this massage. Also, information that you can record for yourself. How good was your nutrition? And then finally, a one-word mood. So what is your mood? What are you feeling today? If you could just record it in one word, what is your mood? Are you feeling joyful? Are you feeling tired? Are you exhausted? Are you feeling negative? Just one word to record. How did you walk into this massage? What mood were you in your body and spirit? Okay, so then I'll have you start the actual session with the stop technique. So the stop technique is a mindfulness technique, and the stop stands for stop, take a breath, observe, and proceed. So it doesn't take too long. So we just completely stop and bring our body to rest. And then we're mindful of the next breath that we take. So go ahead and take a breath in and out. And then observe how you're feeling right now. You don't need to change it or worry about it, but just what is your feeling in your body right now? And then acknowledge that, let it be, whether it's profound sadness because of your journey, because of some stressful thing that's happening in your day. Allow it to be there because it is there in your life. And then proceed. We proceed with the massage session. And I invite you to observe yourself throughout the massage session, because often self-massage and putting our hands on the area that has been operated on can bring up feelings, can bring up nasty thoughts, can bring up frustrations and fears and other feelings. So just be aware that they're there. And I would invite you, if you can think of some positive affirmations, some positive thoughts, and as much as you can, focus on thinking positively, and if possible, saying some positive affirmations as you're working this tissue in your massage after your breast implant removal surgery. So we'll go on to warming. So warming the tissue. This can be a light general massage. It can be that you just took a shower and you stepped out of the shower and the tissue's warm, and then you're going to proceed with the massage. Or you could use some tools And many of the tools I will show you are specially designed for the breast. They're designed for women who are lactating. So this can be a great resource that you can pick up either free or very inexpensively in your community if you know or related to someone that is currently breastfeeding, or ideally has just weaned their child or has just had their last child, and ask them if they have any of this stuff, like taking up room in a box, and if so, could you have it for after your surgery? So this is something I picked up. It smells amazing. It has lavender in it, and this is something that it's made of fabric, and you would put it in the microwave for 30 seconds, and then it just has a gentle warmth to it. And this can be placed over the breast like this. And just warming the tissue for a few minutes. There's another product, and this is called booby tubes, and these are 2 tubes. Against its fabric, and I think it's some kind of buckwheats inside, and it's something you warm up in the microwave. This is nice if you don't want to get any heat or warmth over the nipple area. This can be a little bit more customized, and you have 2 of them. They can be a little bit more customized to exactly where you want to warm on the breast. Since these are fabric and natural, you can't machine wash them or immerse them with water, or I know at least for the booby tubes, they may sprout. The seeds may sprout. So this is something that you wipe clean with a cloth, or if you're crafty, you can make it its own little fabric bag if you're going to be using them long term and you're worried about just like dirt or grease from the skin getting onto the warming devices. And especially if you're going to be using some lotion for the breast massage, you might want to have a washcloth so you can start off with clean, dry skin and then dry and take the lotion off before you use the warming again. The next thing that we can do is manual lymphatic drainage. It's important to find a provider that knows manual lymphatic drainage, and it's the type of manual lymphatic drainage that can also be used to help people with a lymphedema diagnosis. It seems like everyone around is stating that whatever type of the massage they're doing is going to benefit the lymphatic system, so you can no longer just ask for lymphatic massage and expect you're getting one particular style. There's so many different styles out there. So I want it to be a light touch, and you can practice on yourself by practicing actually on your eyelid. So take a finger or your ring finger and then put it on your eyelid and then pull the eyelid sideways until the tissue can't pull anymore. And that's the pressure. All we're doing is we're pulling and gently stretching the skin. It doesn't have to go deep enough where you're depressing the eyeball itself. You're just pulling. You're only using enough pressure, the same amount of pressure, to move the top of the skin across the underlying tissue. So we're not even having to go deep enough into the muscle. We're just doing a gentle skin stretch. And this is really great if you can have a professional session, and then at your first session have that massage therapist demonstrate the MLD, and you can practice the MLD along with your massage therapist practicing it, so you can really get the idea of the proper pressure for the stroke. It definitely does not have to be deep when you're just doing manual lymphatic drainage. We're going to get into a little bit of deeper work further on in this massage. And then vibration. I love vibration, but before vibration, I almost forgot this. If you can't, for whatever reason, your hands hurt, there's still joint pain that you had before the breast implants were removed, and it's tough for you to get into the axilla. This is the part of the manual lymphatic drainage that everything's going to go to, so you need to move around the tissue, around the lymph nodes in the axilla. You can use an empty deodorant bottle. So if anyone you know has a roll-on deodorant, just wait until it's done, or grab it out of the trash, or get anyone who's almost done, and then you can go ahead and hold this deodorant bottle and really intuitively move around and use just a little bit of pressure on the deodorant bottle in order to get those lymph nodes under the armpit. So you don't have to use this. If you feel confident using your hand, you can. But if you want kind of an adaptive device because you have joint pain in the hands, you can use a clean, empty deodorant bottle. So now vibration. So this is the last part of this initial section, which is not as crazy and deep tissue-like as the next section. So this is the last of the gentle techniques, and that is vibration. So I have so many different types of tools for you, and then this is where we'll start to have a discussion with, I want to show you some tools which are silicone and some tools which are not, and this is your own personal decision, but I want to give you the option of either buying or finding a friend that has tools which are made of silicone and tools which are not. So this is a lactation massager, and I got this on Amazon. It's also available in stores, and you charge it up and you press for 3 seconds and boom, there's a gentle massage going on. I love this item because it's designed for the breast. So many other massage devices, especially like these thumpers that people will ask me about, are designed for the large muscles of your body. They're not designed for the tender tissue of the breast. So this massager, you can just use it as vibration, and the vibration is delivered to the tissue. We don't need to push in. It's the vibration itself is doing this gentle work. So we can just use this as a vibration tool and keep it on for as long as you want, just to help any of what feels like the beginning of it might be scar tissue or any lumps. We can just do a gentle vibration on the lump. If you don't want a tool that's silicone, there's also tools that are, this one is like jade, and you plug it in, you turn it on, and this part vibrates. It's made for the face, but you can also use it around on the breast, use it around the breast tissue, and kind of leave it wherever you want that gentle vibration to be. And you can also use a larger tool. So this is relatively cheap, found on Amazon, and you press the button and it vibrates. I like putting it here. So if I put this here, I can feel the vibration gently in both breasts. So even if you're a little bit reticent about using vibration, this might be a good tool. And then also you can use the vibration all around. You can move it all around, but then you can also just have it centrally and do little vibrations centrally, so you're not directly touching the tissue. So those are some possible vibration tools. And then this can be it. If you're at the beginning and you just want to do a short massage, maybe all it is the warmth, the MLD, a little bit of gentle vibration, and then some more MLD, and then you're done. Or we can move on to a little bit more intense massage, and this is the part of the massage where we're working with pressure, either positive pressure or negative pressure. So now we're going into more of the advanced techniques, and we'll start with positive pressure. So this, again, is a silicone tool. This is the lactation massage roller. And this is, it's in 2 pieces, so I'll show all the different ways that this works. So you can use it as a massage roller. So you're just doing a gentle massage on the breast, wherever, in any direction that you'd like to go. You can massage the breast tissue. You can also pull it apart if it's more comfortable for you to be with a straight hand and apply the pressure like this. That is a way that you can do it if it's hard for you to hold a tool like this. And then we also can use this part for negative pressure, which I'm going to talk about in a second. So we have the roller. We also have a pin and stretch movement. So this would be anywhere where you feel the lump. You put your finger over the lump and then with your other finger, you can stretch the tissue out away from the lymph. So that's a pin and stretch technique. You're pinning, and then you're stretching the tissue out. So these are the pressure moves, and then the other pressure move, which is positive, that I'm going to share with this tool. I said it was negative, but it's positive, is instrument-assisted soft tissue mobilization. So that's a mouthful. Some people will also call it gua sha, but I like the term IASTM. And you can use this tool, which is the bottom of this lactation roller. And I love that it looks like a little spoon, because what we're going to do is called a scoop. And I think if you see that there's a little indent here, it makes it more intuitive. So say you want to, there's a little bit scar tissue coming here, you're going to scoop, like you're scooping ice cream. You're going to gently scoop that tissue, scoop that tissue, scoop that tissue. And you can scoop in any direction using the other side. And it's a very slow movement. There should be lotion or some kind of lubricant on the breast to use this scooping technique. And if you are unfamiliar with scooping, this can definitely be something that you can bring along to your massage and say to your massage therapist, hey, can you show me, a little bit of scooping and how it should feel in my massage, so I can go ahead and do it myself. So these techniques start to be where I'm looking for those signs that I said are big no-nos earlier. I don't want any bruising. I don't want any extreme tenderness. Scooping shouldn't be so many scoops that it leaves you with like little red dots called petechiae. It shouldn't leave you with any ongoing redness. And if you want to do that scooping technique, but you don't want to use silicone, these little quartz things for face gua sha are everywhere. They're definitely at Target. They're online. And you can do the same scoop technique with this. And this is not made of silicone. It's made of stone. Okay, so that is the positive pressure. So we'll flip it up on its head and we'll talk about negative pressure. So negative pressure is lifting the tissue away from the skin. So if your tissue is stuck together and you lift it, you're lifting it. So ideally after we do this, your skin, the layers of your body can slide and glide against each other, so you don't feel so tight. You're feeling a lot more looser and able to move. So negative pressure, I'm going to talk about two parts of it. The first one is cupping. So these are silicone cups. I use them in the office. And what happens is you squeeze the cup and then you put it on the skin, and then you can see when you squeeze the cup and put it on the skin, it attaches to the skin and some of the skin comes up into the cup. So this you can do gently without lubricant, but if you want to move the cup around, you should have some kind of oil or moisturizer on the skin to help it. So this is negative compression with a bigger cup. There's also a smaller silicone cup that's made for the face. And again, you squeeze it and then you have a smaller area. And if you had lubrication on the skin, you can go ahead and gently move the cup up and around. If anything's stuck, like some scar tissue, like a lump of stuff is stuck, cupping can help to just move it and loosen it around. When it's time, when the surgeon said, yes, you can use these kind of more intense techniques. If you do not want silicone, the other option is to get a cup that's made out of glass. So these cups come in sets of 4, and there's different sizes. So these are some good sizes for the breast area. So again, the silicone is here, so your hand is touching silicone, but you depress it and then you get it against the tissue, and you can see how it takes some of the tissue up in and decompresses the tissue. There's more area for it to move, and you just need some lubrication when you slide and glide. If I left this on for 3 minutes, 2 minutes, it would cause a bruise. We want it to be on for 2 to 3 seconds, or we want it to be on very gently and then moving around. So that is negative pressure. The other type of negative pressure you can use is called skin rolling. So we take between the thumb and the fingers a piece of skin, and then we're rolling it. I'm using the thumb, which you cannot see, to push it, kind of push it forward. And I'm taking this line of skin and rolling it. So it's tough to explain in a video. This is definitely something where you can go to your massage therapy session and say, hey, do you think I'm at the point where skin rolling would benefit me? And then you can practice skin rolling on the breast, and your therapist can show you and practice skin rolling. And this is different for different people. Some people who have, maybe they're more limber, they can skin roll the skin all around their entire body, and some people it's definitely more difficult to do skin rolling on. So it depends also on your genetics. So this is definitely that conversation you can have at your professional massage therapy session. So those are the two types of aggressive techniques. Then we're going to move into the more relaxation, healing part of the massage, the cool down part of the massage. So we're doing MLD again, and then whatever we've brought up, whatever has been moved, if there's any inflammation in the tissue, we're doing the manual lymphatic drainage to move it out and move it into the lymph nodes so it can go into the processing of the circulatory system, and then eventually you urinate it out. You can also use the vibration tools again. You can use the vibration tools either just generally, or this has like a little point on it, and you can use just a more gentle vibration tool just in one section. And you can use some cooling techniques. I would just be wary of both the cooling and the heating techniques. If you're still numb in the area, I want you to use something that's not necessarily put in the freezer, or something made of a chemical that can get extremely hot or extremely, extremely cold. That's why I like these, which are made of natural products. And I want you to, if you are numb, you have to use more caution while you're putting either heating or cooling on the breast. And then you can definitely talk to your surgeon, your massage therapist, about whether putting something cooling, like a cold pack, or even like a washcloth in cold water, just to cool down the area after the massage. And then, just like we began the massage, we end again with the stop technique. So we take a moment, we stop, we take a breath, and we pay attention as we're inhaling and exhaling that breath. And then we observe, how do we feel after we've done this massage session? And then we proceed, and I have a section on the rubric where I want you to record that heart rate again. How has the heart rate changed since the beginning of the massage, if it has? And then mood, again, what is your mood? What is in one word, how can you encapsulate what your mood is now? I hope it's much more peaceful since you've had this time to gently nurture your breasts and help yourself in your recovery from plastic surgery.